Okay, we're going to start with the very last PowerPoint here, and it's going to be Chapter 8. So we're going to talk about indexes and health data collection. So the two different things that we're going to distinguish between is index and register. Index serves to guide, point out, or otherwise facilitate reference, where a register is maintained as a formal or official recording of items, names, or actions, where a registry is an organized system for the collection, storage, retrieval, analysis, and dissemination of information on individuals who have a disease or condition. Index registers and registries are all considered to be secondary sources of patient information. Let's just review here what some of the primary sources are again. Remember, this is the clinical information when the patient comes in. So this is the information that you take from to get the information for secondary index and registers. So our indexes. Master Patient Index, sometimes called a Master Person Index. It links a patient's medical record number with common identification data elements. Patient's complete name, date of birth, gender, mother's maiden name, social security number. So with this, when we talk about this, the index serves as a guide to point out or otherwise facilitate reference, especially an alpha list of names. Primary and secondary, again, make sure you review them in Chapter 4. Most healthcare facilities house patient records according to a medical record number. So the MPI becomes key to locating this paper-based record in health information. So the purpose of the MPI, it helps continuum of care, it serves as a customer database. An automated one is on the computer and consists of a database, identifies it, and identifies the patient. And then you have the computer interface, which is the exchange of data among multiple software products. And remember, we talked about admission discharge transfer system earlier on. This is used to input patient registration information, which results in creation of automated MPI database. A manual MPI is information, again, on index cards. These are housed in a vertical file. And if anybody has ever seen one of these, email me because I would love to hear about it. You do not see these anymore. These are long gone. Duplicate records. So how do we avoid duplicate MPIs? This happens, again, it should only be entered in by one department. It should be done by the admissions department. And retention for the MPI should be permanently. Disease procedures and physician index. Remember, the disease index is organized according to ICD-10 disease codes, where your procedures are organized to PCS, which is totally inpatient, and CPT, which is outpatient procedure codes. Your physician index is organized according to the numbers assigned by the facility to the physicians who treat inpatients and outpatients. This is the most confidential index there is. Magnetic strip card. It's a small card similar to a plastic credit card. It contains an electromagnetic surface and it holds a small amount of information. Does not require a special reader, but do not confuse this with a smart card. A smart card can hold a lot more personal information, where a strip card information is just your very basic. Indexes are used to complete applications for accreditation prior to survey. The Joint Commission also documents required by licensing and regulatory agencies such as CMS, which is the Centers for Medicare and Medicaid. Your registers contain information about a disease or event and are maintained by individual healthcare facilities, and this is the federal and state government. They focus on a particular disease, such as cancer, or HIV, or diabetes. Case report forms are submitted by healthcare facilities and providers to report data by sponsoring agencies, facilities, and organizations. So the admission register. It's maintained by the admission office. It's organized by the admission date, patient's name, patient number, the admitting doctor, date, admission, and diagnoses. Where your discharge registers usually maintained by the HIM department, and it's organized according to date, patient's name, number, doctor, admission date, and discharge date, and disposition. Both of these are kept permanently. Same thing with the death register and birth register. They are information from the death, the date, patient name, and the birth register the same. These are both also kept permanently. Registers represent a secondary source of patient information, which provides facilities, providers, any public health official with information needed to monitor the health of a given population. This data is called reportable diseases and reportable events. You also have vital statistics. These are compiled for events which include births, deaths, fetal deaths, marriages, and divorces, and it's all maintained at the National Center for Health Statistics. So characteristics of registers or registries: they represent a secondary source of information. They help providers and facilities access information of the health of a given population. You also have an operating room register, and this should be kept for at least 10 years. Date of operation, patient name, record number, and any physicians. You also have the ER record. This is used to monitor patients who enter the ER, and this is required set by the Joint Commission. The Cancer Registry is established for the collection and maintenance of comprehensive patient care on all cancer patients. Two main objectives are the follow-up of cancer of lifetime of a patient. And each year they have to send out and get a 90% response rate back. It also provides meaningful information to the physician for patient care, evaluation, and research, so they can see what one physician did on a certain type of cancer and maybe follow that same protocol. You have hospital-based cancer registry, and you have central. Central is going to be by population or geographic. Cancer registries work with accession registries. They are assigned by the number by year that the patient got cancer. And again, this is a lifetime follow-up, and they have to have a 90% follow-up. Other registries: birth defects, diabetes, implant, organ donor. And then a couple other things we want to talk about is the SEER, Surveillance, Epidemiology, and End Results Program, are sponsored by the National Cancer Institute. They collect cancer data on a routine basis from designated populations all over the 9 areas of the United States.